Welcome to A Closer Look. I'm your host, Linda Fontaine. My guest this hour is Dr. Tom Rodgers. He's the owner of Performance Medicine. Thank you for being here today. Tell me, there's a lot going on in the medical field right now, and there's a lot going on regarding COVID and just staying healthy. Talk to me a little bit about people that are scared to take the vaccine and things like this. What could they do to stay healthy?
Well, you know, it's been a terrible past 19 months with COVID and the world situation, and we've had to deal with a lot of it. And as a matter of fact, we've probably come to the forefront because I'm one of the few doctors that's actually willing to treat COVID as an outpatient early. It's been very, very controversial, a lot of it political, unfortunately. But my practice has always been one that I try to prevent things. When I established Performance Medicine 16 years ago, my sole purpose was to help people lose weight and help take care of their immune system. You know, I have two diabetic children that when they came down with type 1 diabetes, I realized I didn't know anything about nutrition. And I was sitting there writing scripts for all my patients with metabolic syndrome, high blood pressure, diabetes, high cholesterol, obesity. And I realized that I was just piling more medicines on them instead of getting to the root cause of the problem. So my focus in my practice for the last 16 years since I've had PM is to help people take control of their own health, which usually means getting leaner and getting better sleep, exercising, looking at their hormones as they get older. And it's been real successful. You know, people that come to me actually want help. They don't want another medicine. They want to learn how to eat, how to get leaner. And with the COVID pandemic, it's kind of brought my practice to the forefront because about 85% of people that end up in the hospital with COVID are obese. Even if a kid ends up in the hospital with COVID, he or she is usually obese or has a premorbid condition. So I like to really focus on preventing these things. Your immune system should be able to fight something like this off. As a matter of fact, COVID is 99.7 curable or at least survivable. There's some people that you just know aren't going to do well with COVID. There are a few outliers. Of course, I've seen them all. I've treated over 2,000 cases of COVID, outpatient.
Wow.
And a few, you know, when they're sick in person. But it's been a real controversial thing because you can treat COVID early. If you get COVID early, we've got good medicines to ward it off and to kill that virus and to prevent the inflammatory storm that follows the virus. So, but there's certain people that are really predisposed to do bad with COVID. The first by far is being obese. If you watch the news and look at who's dying of COVID, they're usually morbidly obese. As a matter of fact, if you have a BMI over 40, which is morbid obesity, and you get COVID and end up in the hospital, there's a 92% chance you're going to die.
Wow.
So it's really important that we emphasize people getting leaner. I was looking at a study the other night, and 74% of Americans are overweight. That's 74%, that's most of us. And just being a little overweight really puts you at risk for doing bad, not only with COVID, but with diabetes, high blood pressure, heart disease, cancer, dementia. So I think if we turn around and get our focus on prevention, I hope we learn a great lesson from this. We've got a very poor country as far as health care goes. We spend the most health care dollars of any country in the world by far, and yet we're like 33 on the mortality list. It's just because we're obese.
Wow.
So it's a terrible situation.
And so some of the other things would be obesity, and you've mentioned, I've heard you talk about vitamin D deficient. So taking a lot of vitamin D would help prevent.
That's exactly right. That's the number 2 cause that I see people going into the hospital and doing bad. They have low vitamin D levels. I've been shouting for 19 months for people to take at least 5,000 vitamin D with K I even got my cardboard box out and stood on the interstate and had a picture that said "Take vitamin D" on a cardboard
I love that
thing, and it went kind of viral. But you know, it's getting lean, taking vitamin D, taking C, taking zinc. The 3 vitamins now everybody should be taking is D, C, and zinc. And,
how much of that, of C and zinc?
I like 5,000 of D with K. I like vitamin C 1,000 milligrams twice a day. And I like zinc 50 milligrams with food. And get outside, get your sleep, exercise. Your body should be able to fight this thing off. But I'm a really believer in treating early, you know, with repurposed medicines that have been proven to work. They're controversial because for some reason the FDA does not want you to use repurposed medicines and vitamins to fight COVID off.
What do you mean by repurposed?
Well, like medicines like hydroxychloroquine, which is a medicine that's been around for 6 decades. You can get it for pennies over in Africa, and it's for malaria prophylaxis and treatment. But we use it for treatment daily to treat diseases like lupus and rheumatoid arthritis. I mean, we use fairly high doses every day for years. It's a very safe medication. And now I've really morphed into treating more with ivermectin because it's probably a little bit more beneficial for both prevention and treatment of COVID. I use a lot of ivermectin, which is it's not a horse dewormer like they're labeling it. Of course, it's used in veterinary medicine. I mean, we also use penicillin for horses and dogs and cats. Almost every medicine we use for humans, the veterinarians use. So they're labeling it as a horse dewormer, when really it's a medicine that's been around for decades. We've used billions of doses. It's very safe and it's very effective to treat COVID if you treat early.
I've heard of it because I was looking into it years ago when my son, who has Lyme disease, that was one of the medicines that they were recommending for some people because it fights parasites. And a lot of times when you have Lyme disease, you have a co-infection that is parasitic, like Lyme disease, but the other ones too as well. So I've learned a little bit about that, so I know it's used for a lot of different things.
It is. It's a repurposed dirt cheap drug that really works if you use it early. Now they are coming around with, of course, monoclonal antibodies. I've sent many patients for them. You can either get the infusion or you can also get 4 subcutaneous shots as an outpatient now. And certainly for people that are at risk, I would definitely recommend the monoclonal antibodies. At 66 years old, I would definitely get them if I came down with COVID. I'd get it early and I really pop up the vitamin doses. I'll use 50,000 of vitamin D for 5 days when you first come down with it.
Okay.
I'll double the C, I'll double the zinc, and I usually use Zithromax, which is an antibiotic, along with ivermectin. And depending on if your lungs are involved, maybe nebulized steroids, maybe oral steroids. There's a lot of other ways to treat this, but it's been very successful.
Well, I know, well, I've had the shot, and we are now learning, even though you've had the jab, a lot of people are having breakthrough cases getting COVID as well. So we can't just be secure in the idea that just because we've had this shot that we're going to be fine. You know, we still need to take care of ourselves and find out ways to nip it in the bud, so to speak.
I agree. I've treated in the last month or two many people who have had they're fully vaccinated and they still get COVID. You know, hopefully it keeps them from dying from it.
Sure.
But it's certainly not 100% for sure.
Well, tell me a little bit about your practice now. You have 3 offices, right? I know where the one is in Kingsport, but you have one in Bristol and Knoxville too, right?
I have one in Knoxville for many years. I have one in Johnson City right off the interstate in
Johnson City,
Watauga Street, and we're getting ready to open one in Bristol.
Oh, okay. Wow, you're growing.
Yeah, we've had a lot of fun with it because I'm not attached to any group or hospital or, you know, I'm not attached to insurance companies, so it's really allowed me to practice medicine the way I like to practice it. You know, I'm old, but I'll never retire because I enjoy it so much. I like to see people age in a very healthy way and treat them preventatively.
Well, I love that. So you're a cash-only business. That I do know. And how can people get in touch with you if they want to learn more about what you do and the things you recommend? I know you have a podcast too. I want you to mention that.
I do a couple weekly podcasts. Just go on performancemedicine.net,
okay,
and you can see all the things that we do. We've morphed into doing a lot of different things, not just primary care. I do a lot of hormone evaluations.
Right.
I do a lot of weight loss things, nutritional, treat a lot of diabetics. Try to get people off too many medications that they're on.
Mm-hmm. Well, I love that. And you've done I love listening to your podcast because you have a live Q&A that you do a lot on. And is this just on LinkedIn? That's where I see it.
No, it's on Facebook, it's on LinkedIn, it's on YouTube, it's on our website. And it's been really nice because it gets interactive. You know, people ask questions,
yeah,
it's
live,
I love that. And a lot of times I'll learn a lot about what they're doing. So it's turned out to be a lot of fun on Tuesday nights at 7.
Tuesday night at 7, okay. And how can they find it? What name is it under?
Just go to performancemedicine.net.
And it's under that, okay.
It's under that, all right.
And what other pearls of wisdom can you give us before we call it a day?
Pearls of wisdom.
We know to take a lot of vitamin D, C, zinc.
Exercise every day, get a good night's sleep. It's very hard to get rid of stress, but at least reduce your stress somewhat. You know, realize that life is short. Don't stress yourself out too much. Stress is a toxin. It can cause any illness, any real illness. Don't eat sugar. Sugar is a toxin as well. So
it's Halloween.
I know, well, except for one day a year, but having 2 diabetic kids, I'm really against sugar. And that's we've been misled about what to eat. It's really the carbs. There's 2 things I tell people that want to lose weight that will work. 1, way lower your carbs. Sugar's the worst carb.
Okay.
2, try intermittent fasting. As humans, we weren't meant to graze, we were meant to feast or fast. So eat during a certain window of the day and you'll lose weight and you'll have more energy.
I love that. You are such a font of information. We need to have you on a lot more. Thank you so much, Dr. Rodgers, and I appreciate you being here, listening to us today. This is A Closer Look.
Thank you, Linda.